Good afternoon, everyone. Welcome. Hello, hello. Thank you so much for joining us this Monday afternoon. We do have a couple of folks who have registered, so we just want to give them a little bit of time to log in. So while we're waiting for that, would be great if you can share via the chat box your name, your role, your organization. Ideally, a lot of you folks have attended training session number 1 and number 2, but we do have different presenters. So again, if they could know who's joining us, that would be ideal, just to get a sense of who's on the call today. And while you're all doing that via the chat box, I'm going to take a moment to go over some housekeeping information. I'm sure you've all heard this, so apologies for being repetitive. But as we welcome you on our second slide here, again, as you've, the previous slide, sorry. As you've joined, we have just placed you on mute. So just to drown out any background noise that might disrupt others from joining. If we could just advance the slide to the second one, please. We will also have a Q&A, but just as a reminder for folks here, we do have CEs. However, if you are looking to get CEs, it is a total of 4.5 continuing education contact hours. It is a full package. So if you are looking for CEs, you needed to have attended trainings 1 and 2, and now training 3. And there is some criteria eligibility there in terms of being licensed, having listened and participated via a computer or a laptop as opposed to a cell phone, and having used your very unique Zoom link. If you are eligible, you should be receiving an email from our registration system through NYU within the next 2 to 3 business days with instructions on how to submit for your CEs. If you are having any difficulty, certainly please let us know. And on the following slide, again, just a couple of housekeeping things that I mentioned. You have been placed on mute. If you would like to submit any questions for our Q&A portion at the very end, please feel free to put them into the chat box at any point in time. They will either be answered in real time or we'll, again, punt them towards the very end for our Q&A section. If you would like to activate the closed captions, you can do so by clicking the toolbar button that reads Show Captions. If you have any technical issues during today's event, please chat to the CTAC admin host, Felicia, who will be able to assist you with any issues. I also want to point out that we do not allow any AI bots for this training. So again, if you want to do closed captionings, please go ahead and do that. And again, at the end of our meeting, at the end of our presentation today, there is a very short feedback survey form. We would really appreciate you filling that out, as your feedback does help to inform any future iterations of this training and trainings overall. And then lastly, the recording and slides for this presentation will be posted on our CTAC website, mcsilverta.org, within the next 2 to 3 business days. And with that, on the following slide, I do want to welcome you all again to Partnering with Families, training number 3. The last training engagement is partnering with our presenters, Amy Percoli and Dr. James Rodriguez. So I'm going to turn it over to them to get us started.
Thanks, Diana, and good morning to you all. And again, welcome to Training 3, Engagement is Partnering. So I just want to take a moment to introduce myself. I'm Amy Peroli. I am the Director of Peer Support Training here at the NYU McSilver Institute for Poverty, Policy, and Research. I'm thrilled to be here with you all today. And I just wanted to highlight, that my role here focuses on strengthening family engagement through peer support training, while also supporting systems integrate that lived experience into their service design. And today we'll explore how engagement becomes a true partnership when families are treated as essential and equal voices in care. And I just want to mention that I'm also a credentialed family peer advocate. So my lived experience will definitely lend some voices to those that are with us today. Now I would like to hand it over to my co-partner here today, Dr. Rodriguez.
Thank you, Amy. So I'm Jim Rodriguez. I'm the Director of Trauma-Informed Service and Senior Director of Clinical Initiatives at the McSilver Institute and the CTAC. I'm very happy to be here. A lot of the work that I do, I'm a psychologist and social worker by trade and training, and I've been working in the field for many years. primarily in the field of children, youth, and family services, and I've done a lot of work on trauma and trauma-informed care, as my title suggests. I'm very happy to be here co-facilitating with Amy at the CTEC and in my work personally, partnering with people from the community and working with parents and caregivers is essential in the work that we do. So I'm just happy to be here and co-presenting with with Amy, a colleague, obviously, whose work in this space is central. So thank you all, and hopefully we'll have a very sort of balanced perspective here with both the clinical perspective and the perspective of a family peer. So welcome, everyone.
Thank you. So today, let's just start out with just doing a quick overview of our agenda. So today, we'll provide an overview of best practices when partnering with families, and as well as what engagement long-term could look like. And we're hoping to, take you through some of those strategies, and really look for you all to create some space for some shared learning as well. All right, in today's goal, we will also be, hoping to deepen your understanding of family-driven care, that it's not just a concept, but it's a practice. And we really are hoping that you leave with tools for integrating families into care planning and treatment as equal partners within those multidisciplinary teams that we're all a part of. And like I said, hopefully by the end, you'll have some strategies to build some trust, promote some shared decision making, and align care with each of those that we support, those families, and to be able to highlight their unique strengths and their priorities. And I just wanted to just recap a little bit about the training pathway that we've been on to get to training number 3. So, obviously, most of you have been here for training 1, which we were able to discuss, family partnership and have that orientation to the training pathway today. Training 2 took us through barriers, and then today we're going to talk about how to partner with those families, and we are going to touch in a little about some strategies with overcoming some of those barriers to be able to really strengthen, the partnership so that we have successful engagement. All right, so the path towards engagement. Let's embark on that a little bit here, and let's get our conversation started. All right, so successful engagement. Oh, I think I'm a little out of order here. Sorry about that. Okay. I think I advanced a little too fast. So successful engagement starts before we say hello, okay? And as we know, that path isn't always a direct path. There are many obstacles and barriers that, that as providers and as families that we need to overcome. As we discussed in training 2, those barriers are concrete barriers. They can be perceptual, and they can also be provider barriers as well as barriers that families bring with them. And I'd like to think about our path that supports the engagement families. When I think about it, to me, it starts before we even say hello, because I think about it as our approach to how we are going to engage. It's how we prepare, it's how we hold space for families, and it's how we create the space for families to share their story. As providers, there's a role in balancing the need to gather information with helping the family, and to help that family, create that pathway for themselves. It involves being transparent about our roles and about the goals from the start. And I do believe it's about shared learning. Partnership and engagement, it doesn't just happen, nor do I think it's a courtesy. I think it takes a lot of work, and it needs to be for all of those involved to, and to hope that we all have the willingness to be open-minded, and that we do engage with curiosity. And it's important to embrace the families in a strength-based, respectful, and a trauma-informed approach. Laying the groundwork for that strength-based collaboration, you're naturally beginning to lead the family into that family-driven care work. And when we partner, we build trust, we improve communication, and we reduce stigma, and families feel valued. that when families are valued, it leads to stronger outcomes and healthy relationships. And those think about the partnerships that you've had professionally and also personally, right? And think about those aspects of those partnerships. I think we could agree that when we have a more positive level of engagement and we all feel heard and valued, that our it's human nature to want to engage, to want to be involved. And when we don't have that, I think it's just natural to be reluctant, to be a little hesitant to be able to engage in that pathway. All right, so the benefits of family partnership, right? So we know that family-driven care means that families have the primary decision-making role in the care of their children. And that's because the families are the experts in their own lives, right? They bring that unique knowledge and that unique insight that as professionals, sometimes we just simply can't replicate. Some of the benefits of family partnership really is highlighting that they are the experts of their own lives, right? And highlighting that builds that trust and that respect. And when we value that family's perspective, it creates a safe space for families to thrive in, right? And by doing that, you're improving communication, you're naturally reducing that stigma, and you're providing outcomes that are family focused, right? And you're building those relationships and those partnerships so that work can really be done in a really positive manner. All right. So I know that a lot of you are really familiar with the core principles of family-driven care, right? And there's many of them, and it really does focus on families. They define themselves, they're defining their culture, right? It's about meeting them where they're at, and it's about families having their basic needs met, and really having the power to have some shared decision making and the power to have some responsibility for outcomes, right? So I think, moving forward today, what I really would like to just keep in forefront of our minds as we go through are, these three core principles, right? Which is empowerment and choice. And that we remind ourselves that families are the decision makers, they are driving that bus. And that we share that respect for the family perspective and the priorities of those families. Each family comes to us in a different manner, with different needs and different priorities. And, to really have true partnership, we really do need to emphasize to have shared decision making. Okay. So a successful family partnership, right? And how can we work together? And let's think about how we can be family driven. And I really would like to, as we move forward, to really be intentional when we embrace that family driven framework. In developing the collaborative working relationship, that's where we start, right? So we have to set that foundation for this working relationship. Working together as a team, it really does serve the best interest of the child and family. And we have to be mindful, right? We have to be intentionally in starting that work before we meet the family. And we know that first impressions, they leave lasting impressions. And those impressions set the tone, the foundation for collaboration. And it's really in the first moments before you start to think about a family that you think about it to be open-minded, right? You want to enter things and you want to be curiosity-based, right? You want to go in it with a that positive lens to develop that professional partnership with families. We want to be able to identify and really think about our role and think about what the role of the family coming in and what they might be looking for. And we want to be able to balance the information that we know about with the information that a family is going to bring in. And we want to be able to, create that space for families to tell their own story about why they've come into, this space to be able to require some supports. All right, so some strategies for integrating family-driven care. Really, engagement is communication strategies, right? Without the focus of those engagement techniques and the communication strategies, the families tend to get lost in the treatment process. And when that happens, families tend to drop out of services. And you get that hesitation, right? A lot of times, families then are less likely to seek, support in the future. And having families be able to be part of that collaborative relationship will lend the opportunity for families to feel involved, right? We've heard that saying, right? There's no I in team. Well, that's because there is no individual, right? A team is, a process that is a team that shares goals. And when we do that, and you're seeing everybody on that team as partners, right? Doesn't matter what your role is. Well, a family member is part of that team, and they are part of that process, and they are part of developing those shared goals. And when you have a treatment team that empowers shared goals and decision making, you really are, you're just inherently, you're developing good communication techniques, right? And you're thinking about having everyone at the table to be able to have that respectful negotiation, to be able to highlight and empower each of those voices. So I really would like to give some space for all of those that are in the room today to be able to think about, your role on the team, your role as a provider, and then the role as a family, right? Like we come into it with different perspectives. And families come into it with sometimes carrying some really heavy emotions. And their perspective may come into this space really without some trust, right? Families might come in, they may just naturally be experiencing guilt. They may feel some shame, and they may feel judged or misunderstood because of those past interactions with different systems. So I think as providers, it's important for us to, intentionally think about what that perspective might be. And a lot of times when I'm working with families, I also have, really encouraged, those in the family to be able to think about that provider perspective, right? So that you're kind of thinking about where both might be coming from, to understand the dynamics today in at play, and like to think about, what it is that might be asked of you, what it is that might the expectation might be, what it is that you're willing to share, and to be able to, kind of prepare yourself, and to think about how you're going to meet in the middle. So I just want to open it up to you all in the chat, and I want you to ask yourself why and how this might be different. And just to think about it, if you're a family peer advocate on the call, or youth peer advocate, or any kind of peer advocate, think about, the strengths that, from your lens would be able to benefit the partnership. And if you're a provider, right, if you're a clinical provider, think about your lens and, what strengths would be able to bring into that partnership as well. So I just want to encourage you to utilize the chat for that for a few moments. While you do that, I'm going to take a drink because it's very dry in here. Families know what works best for them and their situation. They know what has worked or hasn't in the past. Yes, Erin, absolutely, right? Families are that expert, and we really need to embrace that, right? We need to embrace what has worked for them and what has not worked for them. Exactly, Monica, correct. So Dr. Rodriguez has asked, why and how is family-driven care different, and what are the strengths that each can bring to benefit the partnership? Providers can highlight strengths that have brought the family this far, and that needing treatment isn't failing. Yes, it's very important to be able to definitely emphasize that with families, right? And to be, create that reassurance that treatment isn't failing, right? That, it is something that could be positive. But we have to think about that approach. So there's a comment that says expectations are different, but personally, I think my patience and non-judgmental nature will help foster relationships. I really like that comment a lot, because families do come in this really feeling judged right out of the gate, right? A lot of families are they judge themselves. So I really appreciate that. Yes, families definitely need to be involved in planning, in that decision making. It ensures fairness and reassurance. Yes, it absolutely does. It does. So thank you for those comments. I really appreciate that. And it does highlight, the importance of understanding the different perspectives, and how it might differ from the families, right? And having that understanding of family perspective is a valuable step, towards that collaboration and that partnership. Families do bring their lived experience, right? They bring that into every conversation, that they are having, right? And they're the experts on their family's needs. So their lived experience is their expertise. Just as as a clinician, you're bringing your professional and your therapeutic, experience into those conversations. So when you bring the two together, and you're opening that into, with curiosity, and you want to learn from each other, it really can be a wonderful relationship.
Yeah. And I just want to add, Amy, I think, as clinicians, as folks, mental health providers, behavioral health providers, that Phyllis also made the comment wanting to understand the priorities for the family.
Hmm.
Our systems are oftentimes set up very narrowly to focus on symptoms, right? What are the symptoms? How do they meet criteria for X, Y, or Z disorder? What are some of the practices that are used to develop to address those disorders or challenges, right? Very much kind of a deficit-oriented system. And so in many ways, we almost have to retrain ourselves to also kind of see the value, as Phil is saying, to understand the priorities of the family. Our priorities are oftentimes to really focus on reducing symptoms, right? Getting
Hmm.
folks back to some baseline. And it may sound strange, but that might not always be the priority for families, especially families who are struggling with all other kinds of challenges as well.
Exactly, Jim. Families, they might be coming in and their priority is just to, keep their child safe, right? And, their priority that day is, I want to keep my child safe, and I want to make sure, or it could be, I want to make sure that my child wakes up that day. I want to make sure that my child's getting up, they're getting themselves ready. I want to make sure my child eats that day, right? Like families are coming in with a much different lens of priorities than necessarily, a clinician might have. It's how do you meet in the middle, and how do you communicate and engage to be able to come to that common ground, and to be able to identify what those priorities are. Yeah, so I think I'm going to advance here, and I do appreciate all of those wonderful comments, in the chat box. I love that a lot of them are very family driven, and they're almost all of them are strength based. So I do love that. I do love
Yeah.
that.
Um, and Amy, I just wanted to just a couple of more points, but I think really important. Carrie says families dealing with complex challenges are often referred to and work with multiple providers, right? Which adds that complexity, right? It is
Hmm.
not unusual that they don't know who everyone is or what their role is. So it can be incredibly, depending on the service and who you're working with, or in what service you're working with, it can be incredibly confusing for parents as well. So thank you for that
Hmm.
acknowledgement. As providers and family support specialists, helping them to understand the context, the expectations, navigate the systems. Yeah,
Hmm.
spot on.
Yeah, no, I agree. Yep, I agree. I think that, really having that awareness of, where families are at, and like how many systems they might be, accessing, and it can be very, very overwhelming for a family, right? I mean, at any given time, a family could be, engaging with, up to seven, or more in providers, and it is very difficult. And as a family peer advocate, one of those things that we work on and that we support a family with is being able to be able to, like, break that down, and be able to, kind of gain some control over the understanding of does what, and being able to keep all of that straight, because it is very, very overwhelming. And we have to remember, not only are families navigating a system, they're navigating multiple providers, they're still trying to navigate, what's going on within their family unit, right, within that family dynamic, within that household. So families are, as a parent or caregiver, you take on so many different hats, and you're going nonstop, right? And it can definitely be a lot. So, okay, where are we at here? So the provider, perspective versus the families. So we were talking about that a little bit, about how that is different. And, we were talking a little bit, we started to lean into a little bit about how we define the roles of clinicians and parents within that partnership, right? I think a lot of the comments that we've just been highlighting here in the chat box has definitely touched in on a few of these, right? So we know that families, they face overwhelming complexity and stress. Families, they may feel judged and misunderstood by many systems, right? So families come in with their back up a little bit, which, it can cause a little bit of that barrier for the family and the provider to be able to, kick off that initial engagement. All right. So something that we touched in a little bit about it is like the families, right? And their lived experience and their lived expertise, right? We know that families are experts. They understand what is going on with their families better than anybody else because they are in it, they are living it. Families, when they come in and they can engage, they can bring the knowledge of what will meet their needs, right? As providers and clinicians, we have an idea of what the family is going to need, certainly. But we need to also know what that family needs, right? Because if you're not meeting, on the same pathway, then you're gonna hit some bumps in the roads, and you're inherently going to create some of those barriers naturally. And understanding the family's lived experience will allow for communication to be bridged, right? And what I mean by that is to really take the opportunity and take the time to get to learn what the family story is, right? Before a family has walked into your office, they have a story, they have lived experience. This may not be the first time that they're accessing a service or they're navigating a system. There's some history there within that family, right? That family has a story. That family has, probably experienced a lot of family trauma and is facing a lot of challenges. And creating the space for a family to be able to share their story really allows the family to, just kind of take that reins, and it really does empower those families and those caregivers to really be invested, right? And to be able to say, okay, they want to hear my story. And I want to be able to talk to somebody who wants to hear from me, right? I don't want somebody to talk at me. I want someone to hear from me. And families are more willing to be open and engaging when that's done in a safe space. And when you do that, you're creating that validation, you're creating the trust, right? You're connecting, and you're able to connect the family trauma. And by doing that, you're reducing that stigma, right? Because families, we experience stigma. Jim, did you want to lend anything, from the value of understanding the family's lived experience from the clinician's view?
Well, absolutely. I mean, I think for all of us, as we're trained again, oftentimes we're trained to focus on things like symptoms. But just a reminder, I mean, when we think about children's behavioral health needs, well, and behavioral health needs in general, adult or children, we just have to remember the majority of the information we get, I know it's an obvious point, but the majority of the information we get is subjective experiences of problems that are going on. They're stories. And so we need to understand those stories. I think obviously the parents and the children and youth and families know the stories. I think where we bring in some expertise, where we can bring in some expertise is in, kind of better understanding that story in the context of mental health challenges, but they know this, we are reliant on them to tell the stories of the problems and the difficulties and the challenges that they have, as well as, what helps, what promotes success, what has helped them work through those things as much as possible to drive the treatment plan. There's really no other way to do it. So that's the value, is they know the stories. They know the nuances of the stories, and if we want to put it in our clinical language, they know the antecedents, the behavior, and the consequences. Of course, we as much as possible, we can talk without jargon, but that's it. There are these stories that occur. We want to know those stories again in the context of both difficulties and challenges that they face, as well as
Mhm.
what helps and what has helped them to sort of cope and struggle and work through all those challenges as well.
Right. And to your point of, helping families and understanding, what those challenges are, families might not necessarily even understand, right, what other pieces go into that challenge, right? A family might come in and they're only seeing what's in front of them. But to be able to, lead with curiosity and to be able to ask and to be able to, talk with a family about, their story, it helps a family also process, right? It helps a family also process their pathway to, those challenges that they're facing right now. Because not only when a family is engaged in those challenging situations, it's sometimes it's tough to have that clear approach to be able to know exactly what it is that we need and what direction we're going in, and being able to have a partnership with the provider to be able to have that give and take conversation and to allow for that story to really develop is really, really important. Right. So let's, I definitely want to hear from you all a little bit more. And I want you all to think about the assumptions or attitudes that you might have had or held about parents or caregivers, that you think can interfere with successful engagement, right? So, some, we come in, right? And like Jim, to your point, some of it is subjective, right? So we have information, we're gaining information as provider, right, from maybe from a referral or from like an assessment, so before we meet a family, and if that is what we have to go on, what are some of those things and some of those attitudes that we might hold about parents or caregivers that right out of gate would interfere with successful engagement with families?
And we'll ask some of you to be brave and sort of put yourselves out there, and we certainly invite that in. For those the others, maybe what have you seen? How have you seen kind of
Mm-hmm.
biases about parents play out in your settings? Um,
Yeah.
you got these?
So just
I got them, Amy. So Monica
okay,
says
good.
that they are
Okay.
selfish and care more about themselves than their children. Um, Thank you, Mana. And again, just for folks, there may be families present. We want to get these out there. We realize it doesn't sound, but I appreciate kind of the honesty. These are some of the attitudes they're holding, right? History. People who know an individual or family may have preconceived ideas about them and their engagement. Yeah. They are not committed to their family's success. They don't love their children. Um, and again, just sort of being mindful that some folks hearing these are some of the attitudes that come up. They're not difficult, but oftentimes we do have to confront them. So appreciate it. I hear a lot of frustration around families not being able to engage or seeming to not care about their youth treatment. All of the clients I work with have CPS involvement. I remind service providers that if they could do these things already, that they would not have ended up with us. Thank you, Mary. Michelle says, I work in a school setting and sometimes educators perceive that families are not invested because they are not understanding the barriers that that the family is facing. Thank you, Michelle. And then personal biases have sometimes made it difficult to clearly understand why some families act the way they do. Personal biases have sometimes made it difficult to understand. Um, and I will try Olan Rewaju. If that's close, apologies, but I appreciate Abiola. But I appreciate the comment, right? Our personal biases. And I would say that going back to part of the expertise that we should be able to bring into this work is not just, again, how do we diagnose? How do we assess? How do we gather information? But I will say that I think the other part that's a critical skill we have to have is self-reflection and self-awareness, taking it out of the realm of judgment and bias, right? That self-awareness and attitude is absolutely critical to be an effective clinician, provider, helper. So yeah, being aware of those ones that we carry. And then Lisa says it is generational and they are not there to get help or put in the work. Okay, right. We kick it to generation, right? This is just generational cycles of whatever, fill in the blank. And they're not there to get help or put in the work, right? It's just, we're just seeing these problems go from one generation to the next. And yeah. Sometimes parents in denial, right? Sort of that belief. Again, we're just to be clear, we're not putting out these as facts. We are putting out these as exactly what they are: biases and prejudices and judgments that can come in. Parents are in denial. Um, families may have a different definition of what success means for them. We don't always know the challenges they're facing. Thank you, Carrie. Yeah. Amy, you want to take a couple more of these, or you want to move on? These are all spot on, by the way. Yes, these are all the kinds of attitudes that come. Yeah.
Yeah, no, I agree. They are definitely spot on. And, as a parent, right, sometimes it is difficult to hear those things, right? But, as a parent, I also know that a lot of parents and caregivers, we go into partnerships with that mindset, right? That folks already think about that. It's that judgment, it's that stigma that comes with that. And inherently we might be creating our own biases, right? Of the provider. So it's really, how do you break that down, and how do you create awareness of that? And, how is that, in doing that, how are we allowing ourselves to actually become a barrier, right? So when you have those biases without realizing it, sorry, you're creating, just a barrier in itself, to be able to have that partnership, to be able to establish that partnership. So it's a lot about, we have to think about, how can we, shift that? How can we, shift the approach? How can we shift our lens, into thinking a little bit differently?
Yeah. And Amy, if I may, to that point, actually, no, I'm sorry. Let me not go ahead, because I'll add my thoughts here.
Okay. Okay. So something that, like that I've done, in my experience with working with families, is to really take some time for self-reflection, right? Take some time to self-reflect. As a parent, I'm going to self-reflect. I might come in with a terrible attitude because I'm up against it. Nothing's worked. I've had 10 different providers, nobody sees, what it is that I need. So my biases is already there. So, I've had to learn to self-reflect, and to be able to, having that ability to be able to foster some personal growth for myself, right? So I also think it's really important, for like providers and clinicians to be able to have that piece of self-reflection as well, right? You check in on yourself, right? You're checking in on your biases, and by doing that, you're helping yourself grow personally as well as professionally. And it creates opportunities for individuals to really take a look in, right? And just to say, am I creating a barrier? Are my thoughts and my judgments, and am I biased? And am I the barrier? Am I creating a roadblock to families, and for their success, right? And am I getting in my own way to be able to support and be a successful helper, right? So practicing self-reflection, to me, is something that I always advise, I always encourage. And to be able to, if you need support in that, to be able to seek out, some support from your supervisor, peer consultation, right? Your family peer advocates, your youth peer advocates, your adult peer, certified peer specialists. We really are there to support. And sometimes it's having those difficult conversations, right? And to, really think about, how, as partners, we can think about the judgments and think about those biases, and how can we help mitigate them, together, right? And by doing that, you're creating awareness, you're creating, a better and more strength-based pathway. Jim, did you want to add anything to that?
No, just to summarize, it's getting curious with yourself, right?
Yep.
And getting curious with the folks you work with. That is an antidote to bias and judgment that we all hold, and we all might be impacted by.
Yeah, I agree. And really, leading with curiosity, right? Leading with an open mind, allowing yourself to, be humble, and allowing yourself to learn, right? And to be able to, have that shared learning. You're learning for families were learning from you as a provider, and, allowing, that space to be humble, I think, is so important because it's tough. It is very tough when you have folks that you're trying to engage and you're all coming at it from different perspectives and different lenses. So being able to lead with curiosity and to learn from each other, I think would really be beneficial in breaking down some of those barriers that comes with those personal biases.
Yeah. And if I may, I mean, again, when you're talking about those biases, just a couple of simple things to consider. One is being aware of them. So many of you kind of described a few of them, whether those are ones that you hold or ones that you've seen held by others. It's always critically important to sort of look at that bias. And again, this is on your own bias. And think about, what questions, to convert the bias into a question. How might that question come up for you, right? So as you're reflecting on that, one question should always be, is this me, or is this my bias, right? This parent's in denial, right? Is this me, or is this my bias? Does this person remind me of others who kind of came in similar ways, right? So oftentimes turning those questions inside, and then thinking about how that may also turn into questions. This is optional, but turn into questions for the folks that you're serving. And a question, again, if we're talking about denial, we might be, what do you know? What do you know about you? What do you think about your child's problems, right? What do you think about the difficulties? How do you see them or view them? Certainly exploring strengths is also another way, right? You can enter the discussion, but these are just all ways in which we can take a bias and use it, but you have to use it effectively. One, again, turning it inside, asking yourself where this comes from, where this idea comes from, and then possibly turning it into questions that you can do that can explore and deepen the relationship with the parent or caregiver or family.
Yeah,
So
I agree.
Yeah. So, okay. So embracing partnerships with open minds. So, Amy's been talking about a lot of things, but one of the things that she was highlighting is the importance of communication. So when I think about communication, I think, what are you communicating about, right? If we're thinking about family engagement and parents and bringing parents and caregivers in, what are you communicating about? And so what I mean by that is there's some areas that we know that can be especially difficult for parents to make engagement and connection with parents very difficult. So one of the things we wanted to just mention quickly is we've integrated the unified theory of behavior into this model to understand what can lead to engagement, better engagement with parents, what can lead to parent empowerment. And so super quick, we're not going to go into deep detail on the model, but the unified theory of behavior was kind of written up by Jim Jackard and his colleagues Dodge and Dennis. And so basically what the unified theory of behavior says is that, and this is all I should say, comes from social psychology. It comes from the social learning theory, Bandura, the theory of reason and action by Anjan and Fishbein, the health belief model by Jans and Becker, the theory of subjective culture by Triandis. These are all kind of models that are out there, and I know they all sound incredibly kind of complex, but it was an attempt to kind of unify all these different ideas around behavior, what actually drives action and behavior on the part of folks. And this is what Jim Jackard kind of came up with, these kind of two levels at which behavior and action can be predicted or at least can lead to action and behavior. And so what they like to say is that oftentimes there's these very proximal forces that can impact taking an action. The skills and knowledge, having habits in place to engage in the new behavior, certainly the availability or the presence of environmental obstacles and other competing priorities. These are the things that we often kind of jump to when we think about the challenges to engaging parents into mental health care or mental health treatment, right? And oftentimes, especially environmental obstacles, right? Time, transportation, can you get here? Certainly competing priorities, being aware of and knowing that parents have other children, have their jobs, have other things that they have to do in order to be able to participate. And then habits, getting into habits around coming to sessions. Really quick, And so the other thing that's important to understand about this model, though, is before those things that we oftentimes focus on more, what we're not aware of are the attitudes and values behind the intention to act. And again, it's a very simple idea, right? You are going to do something if you intend to do it, if you have a high willingness or intention to act. And oftentimes what we miss is what are the factors that lead to that high intention to act. Um, and to be very honest, I can apply this model to anything. Super quick, right? Getting a cup of coffee in the morning, right? We might always think about getting that first cup of coffee in the morning as being something that we do, oftentimes out of routine, right? Out of habit. But we don't even think about that behavior, right? But these factors are involved. Expected value, right? How many times do we say, I can't get going without that cup of coffee? I need my first cup of coffee before I can do anything. Expected value, right? I want that cup of coffee. I need that cup of coffee because it kind of gets me going in the morning. Social norms play a role. So full disclosure, I have some health-related problems that sort of have pushed me towards needing to drink less coffee. Social norms. What do other people around you say about a particular behavior, about an action, right? So my wife constantly reminds me, right? You need to cut off. You need to be careful how much coffee you're drinking. But what do others around me think? Attitudes and affect, these are the feelings that we have. How many folks enjoy that first cup of coffee just sitting in a quiet space by yourself? That may be the case for others. For me, it is, right? When I kind of look forward to that first cup of coffee because it's just my moment to sit. I have these attitudes and feelings associated with coffee drinking that are very positive. And then lastly, self-efficacy and ability, sort of that can-do attitude. Now, it doesn't take can-do attitude to drink a cup of coffee, but I will say that sometimes that can-do attitude, again, that ability, feeling a little bit more confident. Again, coffee doesn't always do that for you, but in your mind, you might associate it with that, with those kinds of things that help you get going, feeling a little bit more confident once you have that cup of coffee. And then lastly, skills and knowledge, habits and environmental obstacles. I mean, these are all the things that can get away. By the way, skills and knowledge for me, some folks kind of get into different coffees. They get deep into it. They want to know and have knowledge about different types of coffee, what they are, who they are. Some people get into making a cup of coffee. You become your own kind of private barista and you kind of can make it yourself. So there is skills, can be skills and knowledge. And certainly habits, right? Our daily routines and how we build that in. Where do we get that first cup of coffee from? Environmental obstacles, right? Time. If we're running late, we might have to skip the cup of coffee. Oh my God, how do we do that? How can we do that? But also, and then also competing priorities. So this model really can, now, you may be saying, why is he talking about coffee? Well, so when you think about this model, right, if it can help us understand something like an everyday action, like getting coffee, then what does it mean, for example, in the children's mental health system when we're asking folks to come weekly to individual sessions or family sessions, participate in treatment, give us information. Once we get to the treatment process, right, then there's a treatment plan that we expect parents to follow. Are they on board with that treatment plan? Do they agree with the treatment plans and the actions that they need to take place in order to be involved in that treatment plan? Right? So if you think about the actions here being whatever it may be that's in the treatment plan, participating in treatment, having parallel sessions, sometimes it might be family treatment, sometimes it might be medication, sometimes it might be group, whatever it is, right? Participating in a parenting class, right? All of these things are actions we expect parents to participate in or caregivers or families to participate in. So these are the kinds of things that we have to be mindful of. Does the parent or caregiver see this as a helpful thing, that it's going to make a difference in their lives? How do they see this as something that will contribute to their children's lives and their own lives, right? What do other people think and say? What does grandma say about this? What does my sister or brother say about engaging in children's mental health treatment, right? There may be those push and pull factors in their social world. What do I feel and think about it? What are my attitudes? Oftentimes, right, past bad experiences or past experiences with mental health can come here, right? How do I feel and think about, again, engaging in mental health treatment in the first place, or any of the things that we might be expected to do as part of that? And do I believe I can make things happen? This is a big one for parents and caregivers, right? Oftentimes, do I feel like I have the agency, the ability, the self-efficacy, the confidence to do all the things that might be involved in children's mental health care? And then, of course, the same thing, skills and knowledge. And skills and knowledge could be an understanding of, why it's important. Psychoeducation becomes important here, right? Certainly habits. How do you create a habit so parents can come routinely and regularly? And of course, oftentimes the things that we focus on, environmental obstacles, time, childcare, competing priorities, how do we help to manage those in the lives of the people we serve? So these are all the things that can kind of lead to, in this case, participation and engagement in treatment, but also any other aspects of treatment that are related. And so I like to put this out there because typically what we have to then think about is what are the strategies that we have kind of increase the likelihood, improve the likelihood that parents and caregivers will be participating in children and youth will be participating in care. And all of these become important. So what we're going to do is we're going to walk through these one by one, and we're going to ask your input as well about these various factors and what you think. So some of the strategies to address these barriers. So first, the way I'd like to put this is increasing buy-in and intentions. That's that first thing, right? Expected value. Engaging in caregivers and care involves creating a holding space for their lived experience. This is where you can find out about their intentions. So question to you all if you can, fairly quickly if you can think about it, but what strategies do you use to ensure that parents and caregivers understand that seeking care and or partnering you outweighs the perceived challenges and costs, right? And by the way, just a quick judgment thing, right? It's sometimes we hold the attitude that all of those things should be outweighed. Like if you're not taking care of your child and prioritizing your child because all these other factors are out there, or you're not sure, right? That's part of our judgment and blaming that can come into play. But what do you, and please feel free to chat in. What strategies do you use to ensure that parents and caregivers understand that seeking care or partnering with you outweighs the perceived challenges and costs? Discussing how things are working now versus how they would like it to be, encouraging that they are in control, that they have a choice to say no, and that they can quit at any time. Yes, sort of, right? Often, oops, sorry. Let me go back because we're here. Just going through and being able to kind of bring them in and kind of tell them a little bit about what their expectations are, or how they might see things differently. And then certainly giving them autonomy, right? You choose. You certainly, motivational interviewing, speak, right? We often talk about providing autonomy and a sense of control. Acknowledging their point of view. Amuna, acknowledging their point of view while making sure their needs are met is important, their points of view and that their needs are met, right? And if I may, Mona, sometimes that can mean both their needs as a parent, what do I need to do to support my child? But sometimes we have to recognize parents themselves have their own needs that are being met or not met in the context of a child's challenges or not. It could be things not related to the child's challenge. Again, our systems are oftentimes focused to sort of sidestep that, right? Sorry, that's kind of your thing. What I'm focused on here is your child's mental health. Empathy, making time for them around their schedule, being useful, a useful link to helpful resources that help alleviate barriers. Thanks, Michelle. And Carrie, voice and choice and the understanding that their participation is voluntary. Okay. And I'll just take one more and then we're going to move on. Amy, if you have any thoughts as well, please feel free. Like, what do you see as some of the things that help increase a parent or caregiver sense of high value in what they're engaging in?
Yeah, absolutely. And I would have to agree with almost all of these that are in the chat, right? So family voice and choice is really, really important. You want to be able to empower families to, really, use their voice, right? And to be able to make those choices and be an active partner within, the plans and, the direction of what is needed for their children. And, creating that space for that to happen, right? Creating that space, going into it with those trauma-informed approaches, really creating safe space, and really, just engaging and really listening to hear families, right? Not listening to just listen, but listening to hear families, and and providing that encouragement, right? And really, just organically being engaged, right? You want the families to really feel that you are there and that you are there to walk on their path with them. So it's really important to create safe spaces for that.
Fantastic. Thanks, Amy. We're going to move on. We're going to move on, but very helpful. Just a few things that may, and this is kind of embedded in some of the responses that we got. Explore past experiences with behavioral health care. That's just a reminder, right? So this is where your expected value of your current treatment team or person or provider might be based on those bad past experiences, right? So having conversations about those past experiences. What have you ever gotten treatment before? Have you ever gotten to see a counselor, right? All of those are critically important and can offer a space for you to also be able to say, well, this is how I hope this will be different. And if it's not, or if there are things that happen that kind of remind you of that, kind of bringing them into the space and empowering them to share that with you. Using motivational interviewing strategies, exploring hope for children and self. Use these to frame goals, right? What are your hopes for your children? What are your hopes for yourself? And are there some ways in which we can integrate that into the goals that you're already framing? Explore ambivalence, right? I'm not sure about this. That can, again, go not only towards ambivalence just about participating in treatment at all, to ambivalence about the specific treatment goals or treatment interventions that you're laying out. And then engage importance of those goals. So again, one of the problems that we have in our system is sometimes the goals are given to families, parents and caregivers and youth, given to them. Just, this is what we came up with, right? What are the importance of these goals to you? At least having them be involved in the development of those goals. I should say that should always be the goal. And then also getting their ideas around the importance of this goal. If we hit this goal, how important is that going to be to you, to your child? Share positive outcome stories and testimonials from others, from other families. This is a place where family peer advocates and others can also provide some support, sharing their experiences with positive outcomes in your program. And then engage and share decision-making with the family in support of the child's strengths and potential. Right? These can always be tied into their experiences. So moving on. Oh, and then of course, instilling hope. Amy, did you want to share this? Because I know you talked a little bit more about the importance of instilling hope.
Yeah, absolutely. I would love to touch in on that. So part of, creating that safe space, right, and really empowering the voices of the parents and caregivers is, in part of that active listening, right, is in doing that, you're hearing them, you're hearing their messaging, but then you're also messaging back that you're validating, right? You're validating that, they are an active part, right? That they are the experts, right? They have the expertise of their families, right? So you're validating that they're strong, that they're resilient, right? And you're highlighting where they are, right? So families sometimes don't see the little successes, because like I said earlier, you're in it. Sometimes you're only able to see what's right in front of you, and you're just trying to get through the challenge of that day. Right. And sometimes it's hard to see those little successes. So when you instill hope, and you share that message, and that you are growing, that you've overcome obstacles, as and you are, as a provider, you're really you're really helping to support that and to highlight that, and that's really being strength based. You're highlighting those strengths all the time. And when you celebrate the little successes, you're really moving towards the larger success. And you're focusing on the future without, focusing on the past, right? You're always looking forward. You're always moving forward. And in doing that, you're helping families and caregivers to be able to, overcome some challenges, as well as create some skills for themselves, some skills of acknowledgement, some skills to be able to cope, some skills to be able to move forward. So it's part of that. Instilling hope is really important, an important part of the family story. It is very, very important to the family's path. So, and if we have the capability to be able to do that, we certainly should be doing that for families.
Thank you, Amy. So we're going to move on to the next space, social norms. Remember, right? What are other people around you saying? So what are some strategies you use to explore and understand the impact of important people, family members, friends, co-workers, whoever it may be, in the lives of the parent caregivers? And by the way, and or the isolation that parents and caregivers may face. All right, because oftentimes having a child with mental health care needs and challenges can also lead to isolation. But what are some of the things you do to explore and understand the impact of others, significant others in the lives of folks you're serving, and isolation? So please share in chat in your thoughts. What are some things you do to explore and understand the impact of important people in their lives, the influences, the folks around them? And Amy, it could definitely be that folks are just typing in, but if you want to share your thoughts about this and why it's important for folks to understand.
Yeah, absolutely. When I think about the impact of the important people, right? I'm thinking about those natural supports that families, that parents and caregivers have, right? That can help reduce that isolation. Those folks are part of, that dynamic of support that a family receives, right? So families are, we're getting support from providers, we're getting support from different peers, but we also have those natural supports that, families, parent givers identify, right? And we think about, the influences that those folks might have. And they do play a very, very important role in reducing the isolation, and to be able to support parents and caregivers, along that pathway. So I'm starting to see folks chat in, asking parents to identify who helps them or has been a big influence in helping them get there. Yes, exactly.
Yep.
Those supports can be anybody that they identify, right? It could be, a family member. It could be, if you're faith-based, it could be, your pastor. It could be your child's coach, right? If your child's into sports, it could be a child's coach who's been there and been able to support. Aaron said, who's helped before, right? Who's available to help now, even if you don't think they are? That's a great question to ask. Families might not be thinking that way, right? So if you ask that question in that way, you're going to get that individual to think about it and say, oh, right, I do have somebody that can help me. I forgot, and this person already does help me. I wasn't even realizing that they helped me. Carrie just chatted in when facilitating wraparound meetings. We always ask who the family child feels are their supports. Great question to ask, right? That's part of that family story. It's part of who the family or the child might be identifying, that they see as supporting them. Sometimes we might not even see that person as a support. But that's really being, family driven. And it's really, taking that into, keeping those folks in the driver's seat and being able to identify who is part of their team.
Yeah.
Um,
Amy,
yeah, go
so
for
I'm
it.
just looking at a couple. Tanya says learning the sphere of influence. I think I've heard of that as well. So certainly there might be tools out there that you use to assess family sports or the sports that people have in their lives, right?
Mm-hmm.
So like not formal tools, but actually some of them are formal tools of, what are your support systems? Absolutely. Who's helpful for. I'm with you too, Amy, the other one. So like Michaela says, don't just push the parents and caregivers' feelings aside. Ask them how they're doing, what they need, and who their supports are, right? Just straight up ask the questions. Great.
And I do
Wonderful.
like, I'm not sure if I'm going to say this name right, Amunia, um, you know, uh, chatted in that it takes a community to help reduce all stigma revolving around mental, physical, emotional, depending on the circumstances or the ethnicity of the family. It's important to try to at least get everyone around the family involved in the process. Agreed,
Yep.
right?
Thank
Because,
you. Yeah.
that creates that network of support.
And yeah, and I'm glad that you bring in the word stigma, right? This is oftentimes where stigma can live as well, right? In the people around you, the what they're saying, who they're saying, how do they view your child, all of those things. Fantastic. We've kind of touched on these already, but explore and assess social support systems. You've talked about this, whether you use the circles of support or those levels of, I forget how, but how it was framed, but yes, levels of influence, right? Normalize and validate help seeking. Just reminding that many parents struggle with this. You're not alone. Collaborating with family peer advocates. Again, we've mentioned that before, to explore share experiences and reduce stigma. So if you have a family peer advocate, oftentimes that's the person who can help reduce stigma because they've walked through the same shoes. And then partner with cultural and community leaders who endorse mental health services. Are there folks out there? This is where when we often talk about cultural responsiveness. This is definitely one of those interventions in that space, right? Who are you working with in the community who can, really talk about the importance of mental health? And then addressing parent and caregiver isolation. Sorry, there's not much there, but the idea that, as someone mentioned already, checking in with them, how are they doing? And then certainly kind of exploring the possibility of isolation in their lives. Moving it along to the next area. So as we mentioned earlier, in the model, this would also deal with the parents' emotions, right? Amy mentioned this earlier, right? The emotions that parents come in with, and some of them are very predictable and some are not. What strategies have you found work to address some of the emotions that parents and caregivers of children with mental health care needs may experience that can interfere with engagement? And for now, just focusing on that can interfere with their ability to connect with you. Again, while we're waiting for other folks to chat in their responses, Amy, if you want to share your thoughts.
Yeah, absolutely. And I was thinking a little bit about, the isolation piece, right? And, that's a really strong emotions that parents and caregivers feel, right? You feel that you're on an island all by yourself sometimes, and you just don't know who to turn to, right? So a lot of parents come into treatment, or, any kind of support, already feeling that way, right? They already feel that they're already defeated, right? So those kinds of emotions, they're there. Parent might not actually, project those emotions, which does make it a little bit more, difficult, to be able to connect. But that's where, being able to have that curiosity, that, being able to listen to hear, right? To be able to allow the family's voice to, have a space and learn that family story. Sometimes a parent, just isn't ready for that, but really creating that safe space. I always go back to that safe space, because I myself, I was one of those ones that I knew all of it. I knew what my child needed. I had my, my education that supported that. I had my personal and professional experiences supported that. But when it was my child, boy, did I feel isolated. I felt, very isolated, not only, within, my own, just inner circle, within my family as well. Like, people just, it's, very difficult for folks to understand, maybe what you're dealing with and what challenges that you're facing as a family. So that isolation is really, really, to me, that sticks out. And it's really important to be able to, try to find some strategies to find some common ground to be able to support that.
Great, thank you. And we have a couple of chats, not being allegation based, but solution driven, definitely focusing on solutions can help, helping them find ways to resolve issues rather than dwelling on the negative.
Mm-hmm.
That could be really important. Just a reminder, sometimes we can sit with that discomfort and pain, but helping folks move forward from it. Validation and some of those strong feelings. Yes, Michelle, really important. Validating those experiences, validating those feelings, is oftentimes the major go-to here, and so critical. I'm going to jump ahead to some of the things that we've shared, but yeah, creating a holy space for balanced feelings and emotions to emerge, right? Just creating that space. And being open to it, providing trauma-informed support. What happened, right? When we think about trauma-informed care, the mantra of trauma-informed care is moving from what's wrong with you to what happened to you, but certainly exploring some of those feelings, where those feelings are coming from. And then absolutely, as was said, Michelle, normalize and validate feelings, fears for the child, mistrust, stigma, self and other blame, ambiguous loss, anger, before problem solving. So all of those feelings, right? We have to understand those feelings and because obviously those very strong feelings can drive engagement and participation in care. And then providing psychoeducation also, again, I mean specifically, oftentimes, especially for fears that parents may have about their child, or fears about themselves. So providing psychoeducation about, the effectiveness of our approaches and what can happen, and how, in many ways, we can keep folks safe. Incorporate stress reduction and grounding techniques in your work, right? So oftentimes we have to help parents deal with the stress that they're experiencing, and grounding techniques or mindfulness activities or relaxation activities that you can do with parents in session. And then actively remove blame. And certainly what I mean by that is just exploring it. We know that's a very common thing. It doesn't mean every parent experiences it. But I would find it difficult for it is so common, regardless of whether you're talking about a child with special needs or a typically developing child, actively removing blame, but that also means asking about it and seeing, and being mindful of that. Okay,
Yeah,
the
and Jim,
next here, yeah.
I
Oh,
just want to
please go
add to
ahead.
that last one about
Yeah.
actively remove blame, right? So, a lot of parents, they may, come in and talk about, well, I feel like I navigated this system and they blamed me, right? Or, this provider blamed me, right? There's like that piece of blame, but there's also that personal blame, right? So as a parent or a caregiver, sometimes we personally, without even letting you know, we personally are blaming ourselves for the situations and the challenges that our children are facing. So that runs really deep within parents and caregivers. And, that might be one that takes a little bit more time to surface up and to be able to have that conversation. But having an awareness of that personal blame really can be important to have when you are, thinking about all of these strategies, because it really is a real part of being a parent with a child with challenges.
Thank you, Amy. And then, and one last area we just went to a little bit more deeply, and then the others we're going to kind of move a little bit more quickly through. But the last thing, self-efficacy and empowerment, right? This is ultimately the holy grail. What we're hoping that parents feel is that they're able to have some agency and support them in that journey towards agency and empowerment. So what strategies help to promote a parent caregiver's belief in their ability to manage and overcome obstacles, feel empowered, and participate in care and treatment? What are some of the things that you all do? And Amy, certainly, your thoughts. What are some of the things that you've seen help?
Yeah. I see that Phyllis had chimed in. If a person needs to be silent, let them know that's okay too. Explore it at a later time and why the silence is needed. I love that. I love
Yeah,
that because you're really respecting the individual where they're at,
right.
right? And that's
Okay.
just, meeting somebody where they're at, meeting a family where they're at. That's very respectful. And that really does show that you're intentional, that you're engaged, that you're there to support, that you're there to really move forward in the strength base. You're not going to try to pull it out. You don't want to make somebody talk about something that, maybe be very difficult at that time to talk about. Yeah, and when families are, when they are heard, right, or and you're working with them to manage and overcome obstacles, and they're empowered, right, they want to participate in their care, right. When families feel capable, they participate more fully, right. You in doing that, you can help set achievable goals, right, and it's celebrating the progress, celebrating all of those little successes. Even, as a parent, my success today might be that my child got up and went to school. They might not have gone to school all day, but they got up and went to school. And that's a huge success that, I would want to celebrate. And being able to, reinforce that, and reinforce that it might not be perfect, but it's a celebration. So, you know, definitely being open-minded to that.
Thank you, Amy. And so these are some of the things that we've talked about. I haven't seen much in the chat. Folks maybe get a little bit tired, but self-efficacy and providing family choice and voice and establishing treatment goals, right? Like how do you integrate those treatment goals into things that address their felt needs, provide affirmations, identify strengths, right? And as Amy's saying, right, sometimes that takes, you know, she as a parent sort of recognizing her own small steps, but also for us as well, right? Seeing, you know, all those small steps coming to, you know, engaging in conversation. Break tasks and participation into small, achievable steps. This gets into more when you're moving into treatment and obviously treatment goals and what the expectations are for parents to participate. But certainly breaking those things down into smaller, achievable steps, providing opportunities to build skills for self and child advocacy, right? How do you advocate yourself? Certainly self-efficacy means that confidence to be able to also advocate for yourself. And then I think as Amy was touching on, reinforce all successes and effort, not just outcomes, right? What are the small steps that they're taking and identifying those? Amy, in the interest of time, I'm gonna kind of go through these last few. So remember, those are all kind of the attitudinal, sort of perceptual challenges that parents and caregivers may face. So unless you have a good understanding of those things, it's going to be difficult to kind of address those, which definitely, and please let us know if those make sense to you, right? And there may be other factors that can, again, attitudinal or perceptual factors that may interfere with engagement. Engaging parents also means clearing space for action. So that means how do you do? So these I'm going to kind of go through quickly, but what strategies do you use to ensure that parents have the skills and knowledge to actively participate in treatment? What are those skills and knowledge? And here, some of the things that are critically important, clearly laying out expectations and explore readiness for engagement and change. What does participation mean? When they come to you, what are they going to be doing? What are they going to be doing with you? What are their children going to be doing with you, right? So what does participation mean? This is just talking about engagement. Provide concrete hands-on instructions, certainly when you're expecting them to do things like whether that be medication or participating in treatment and family, engaging in new parenting practices, all right? Providing opportunities to role play and model. That could be anything from role playing and modeling advocacy and how you ask questions and who you do that to, as I mentioned, any of the specific things that may be part of the treatment plan. Offer visual and written aids in plain language, giving opportunities for repeated practice. So these are all the things around sort of gaining the skills and knowledge to be able to do the things that we expect them to do as part of participation. And then, you know, we've said this often, providing psychoeducation. Amy, a quick thought on that if you wanted to share any?
A quick thought I had on that is really to be transparent, right? You know, so when you're laying out those clear expectations and you're exploring the readiness for engagement and change, be transparent, right? But also do it together, right? So if you're laying out expectations, for treatment, ask the family, well, what are your expectations for treatment, right? Have that shared planning, that shared decision making. And that way, you know, you're meeting each other together, right? You're meeting in the middle and you're working on that together. So you're not, you know, just telling you're going to do, but you're working together, you're doing with. So, you know, and transparency is really important. The more transparent you can be for a parent, I personally think is a great thing to have, because we have to remind ourselves that, you know, a parent may and a caregiver may not only be working with just one individual. There's many different people that are in that person's lives, and also, you know, multiple systems as well.
Yeah, great point. Great point. And I appreciate the inclusion of that principle of transparency, right? So for those who might be, you know, trauma-informed care, when we think about trauma-informed care and kind of aware of trauma-informed care, transparency is one of those. We've mentioned others, power and choice, that are there. So you could see those principles really embedded in these strategies. And then the next one, what strategies have you found work to address some of the concrete and systemic barriers that can interfere with engagement? You know, and Amy, if you had others to add, but certainly, you know, things that we often talk about, and I know these are things that we've shared before, but flexible scheduling, telehealth, or in-home sessions, connecting families to case management and support and/or supportive services that can help, engaging family peer advocates to help in problem solving around those environmental obstacles, and proactively asking about those barriers, transportation, childcare, the scheduling of sessions, and all of those kinds of things. Amy, I don't know if there's anything that you wanted to add. This is just sometimes kind of rolling up your sleeves and trying to figure out what in concrete ways is getting in the way and addressing them. But if there was anything you wanted to add.
Yeah, no, I love that you said that, rolling up your sleeves, right? And just trying to troubleshoot it and be creative. We have those concrete barriers. There's transportation, there's childcare, there's, scheduling barriers, right? And like really trying to be creative, and think outside the box. And that really speaks to meeting the family where they're at, right? And, and again, that shared decision and process, really it's valuable because the family might have an idea that's going to work for them. And why is that? Because they know what works for their family, right? So just kind of keeping that dynamic going, and being family driven, and just trying to come at it creatively, really be creative. I know during COVID I got really creative in meeting families where they were at, so I know it's possible, but you really, just to be creative, be
Yep.
open-minded.
And this is also a good reminder here to that our systems oftentimes put those sort of burdens on us that we have to deal with around scheduling and time and the availability of flexibility and scheduling and all those things. So we're aware of the fact that sometimes those obstacles might not be under your control.
Hmm.
So you kind of rolling up your sleeves becomes critically important. And then what strategies have you found to develop routines and habits, right? So routines and habits around participation in care or specific interventions that help. This one gets into more details around the specific interventions, right? So for example, yeah, like if you have to put a child in medication, or if you have to attend a set of classes on parenting or whatever it may be, what are some things you do to develop routines and habits? I'm going to share a couple and then your thoughts, Amy, and please from the audience if there are any others. But also consider creating routines for family and parent contacts, for example. I do this with my kids. Why not do it with parents? Roses and thorns. What are some of the things that help you just check in with the parent? How are you doing? Let's check in on how you're doing first. What are some grounding techniques that we can use? So just checking in and building that, right? How are you doing as a person, as a human being? So integrate new practices into existing routines. So that's getting more into the specifics of treatment plans and how do you do things like, again, whether that's medication management or any other specific intervention, but how do you integrate those into existing routines that are there? Utilizing reminders and scaffolding, scheduling short-term check-ins on a regular basis to reinforce new and emerging habits, especially early on. How are you doing with X, Y, or Z intervention at home? These are things that we would do with the children and youth that we're working with as well, right? So they should also be things that we're doing with parents. I don't know if there's anything you wanted to add, Amy.
Yeah, the only thing I wanted to add is when you're thinking about this, right, and you're considering routines for family, and for the parents and the caregivers, as well as the youth that you're supporting, but also in considering those routines, right, consider who else might be involved in that family, right? Consider the other providers. And really, I know we're talking about engagement, with a family and with the provider and the clinician, but think, just kind of remind yourself more broadly to think about, the engagement, with that team, right? You got to remember, taking it back to the beginning, there's no I in team. And there are more than one or two folks part of this team, right? So just kind of when you're thinking about those routines and you're thinking about integrating new practices, trying to be open-minded, and to think about the full approach, right? That full multidisciplinary approach. So
So,
I'm
Amy, yeah,
yeah.
Amy, I want to do a quick check-in with you. We're a little bit behind. We only have about 7 minutes left. I know you have a few
Yep.
points to come in, but I definitely wanted to see if folks had some questions. So, how do you want to proceed? We're okay. You want to take over on these last few?
Yeah,
Yeah.
I can definitely go through and just really encourage folks to chat in your questions into the chat because we are monitoring
Yes,
that. So if you have any questions, start throwing them in that chat now. And I can really go through these last few slides and close it up.
perfect.
Yeah, so one of the things that I wanted to just highlight is when it's going well, right? So when it's going well. So, we've put a lot of work into this. We've put a lot of conversation into the strategies and to really have successful engagement. So, all right, we got there, it's going well. We want to continue that process, right? And I think it's important to be able to not lose sight of when it's going well that there is still work to be done. And I found it that the most productive work in a partnership is when things are going well, right? When the family is no longer in a state of crisis and they have that clear mind, they feel good, they have strength, you're celebrating those successes. And you continue to foster the encouragement and the confidence. That's when growth occurs, right? That's when the families can really start to see that larger picture and really start to really embrace the value of those partnerships. So just moving ahead. In doing that, you're empowering, the young person in the family to share their story, right? You want to continue to empower through education, and continue to empower through exploring new strategies. So when it's going well, don't don't just, rest on what's been working. You're always thinking ahead. You're always looking forward. One of the things I always said when I would start working with a family is, I'm in this to not be in this, right? I'm in this to support you, to be able to have the skills and to be able to have the capacity to be able to grow through adversity, right? We want to be able to support families in recognizing their resilience. We want them to continue to build their story, continue to problem solve, continue to gain their confidence. And in doing that, our roles, we shift from guiding and affirming to, providing the education, the support, and the hope, right? So we want to continue that success. In doing that, while you're doing that, without realizing it, you're empowering families as leaders, right? So when you take it back to engagement, right? Families, we're part of that team. We are the experts. We should be part of this team. We want to be able to engage. We want to have this successful partnership. And when you tie it all together, you're empowering families to be leaders and to be the change agents of their own care and of the care of their families, right? They're in the driver's seat of their own success. So without realizing it, when you are establishing, really strong engagement partnerships, you're empowering those families to be leaders into, the pathway of care. And it just that's so successful for a family. It's so empowering to be able to say, you know what, I am proud of where I've gotten. I'm proud of the successes that we can celebrate within our family. I'm proud of where my child is. And having, a very strong partnership does that for a family, right? It really it allows us to see that, we aren't the blame, right? That we can continue to move forward. So tying it all together, right? When we recap everything that we've talked about, we want to continue to provide that positive feedback, always instill hope, right? These are all the strength-based, approaches, these strength-based skills that, really will foster success, right? You're by identifying the barriers to implement change within day-to-day life, you're helping problem solve around those barriers. We have to remind ourselves to take time to understand the family's perspective and that family story. And really, respect the privacy and the confidentiality. Those when we trust a provider, it takes a little bit to get for us to get there. But when we trust, it's important to respect that trust. Because once a family feels that they aren't being seen or they're not being heard, then we lose a little bit of that trust. And when that happens, that momentum that you have with engaging in that partnership, it starts to stall out. So you want to contain, maintain that trust, and really move forward, and be family driven and be strength based.
So folks, I know we're almost at time.
I know.
It's okay. I think we've certainly gotten a lot of participation on the part of our audience. So thank you all for the comments and your participation earlier and integrating your thoughts. We do have some upcoming events. I wanted to mention these. Felicia, if you can, Felicia will put into the chat a link to our feedback survey, and a little bit of a post test. So please take a moment before we stop officially to at least open that up. Certainly give us feedback on today's webinar. And just so that you know, a recording of today's webinar and the presentation slides will be posted on the website within 2 to 3 days. So please take a moment to complete that survey, get it back to us. Any final thoughts, Amy? Let me just see here. Oh, and here we go. And I know
No,
you
just
had these final
thanking everybody
thoughts.
for being here, right? I just really appreciate everybody's space, the voices, the comments, and sharing the strategies that work for them. So thank you.
Thank you, everyone. Have a great rest of your day.